Hello, my name is Sverker Sikström. I am a professor in psychology at Lund University. We are developing AI tools for assessment and treatment of mental health. These tools will help you, as a clinician or a patient, to take the advantage of generative AI. Let me walk you through how it works. Our tools are based on a simulated clinician that we call ALBA. Patient can chat or talk to ALBA by clicking on a link. ALBA will first make a clinical interview with the patient. The clinician can then log in to our TalkToAlba webpage and get a motivated suggestion of the patient's mental health disorder. The clinician can then discuss the patient with ALBA. Finally, the patient can conduct a cognitive behavioral therapy with ALBA. Our tools also transcribe the session that clients have with the patients. On the clinic's webpage, patient can connect to ALBA by clicking on a link. This can be done at home or at the clinic. In the clinical interview, patient can chat with ALBA in natural language. ALBA will conduct a dialogue with the patient about his or her mental health. It will first find the most likely diagnosis and then carefully check if the patient fulfills the diagnosis according to DSM-5 criteria. The patient can also listen to ALBA's questions and talk back. I've been feeling tired and low, haven't really felt like doing anything useful, and I'm just basically staying at home all the time.
I'm sorry to hear that you've been feeling this way. Can you tell me more about how long you've been feeling tired and low?
I guess the last 3 weeks I've been doing that. It was after my girlfriend broke up, and I didn't really feel good at all, and she was like cheating on me.
It sounds like you've been going through a really tough time after the breakup. Breakups can be very challenging, especially under such circumstances. Have you noticed any changes in your appetite or your sleep patterns since this happened?
After the patient completed the clinical interview with ALBA, the clinician can log into the TalkToAlba webpage and view the assessment. ALBA will suggest the most likely diagnosis and presents the likelihoods of them. Then ALBA will take the most likely diagnosis and carefully check each criteria according to DSM-5. It will say whether the criteria is fulfilled and provide a verbal motivation of it, and provide how confident it is. Finally, ALBA will estimate how severe the diagnosis is and how acute the patient's needs are. In this way, ALBA can help prioritizing which patient needs care first. In this way, ALBA can serve as a decision support for the clinician. This will speed up and provide additional information for the clinician prior to meeting the patient for the first time. ALBA can also assist by record and describe the session that the clinicians have with the patients. This will provide additional information which will improve the assessment. Sometimes assessment can be difficult. In this way, clinician can get help by discussing the patient with ALBA. ALBA will be a helpful assistant that can provide informed feedback of the patient. ALBA is not only a useful tool for assessment, it can also provide online cognitive therapy. Patient can log in to a link, and ALBA will ask to what the patient are seeking support for. It will teach and suggest useful CPV methods for the patient. At the end of the session, ALBA will provide a plan and a schedule for a new meeting. The patient can also return to ALBA, which will remember everything that the patients have said.